Hey guys, welcome back to my channel. If this is your first time here, then welcome, and if you are already subscribed, welcome back once again. I want to thank so much a couple of new subscribers that I have on my channel. Thank you so much for subscribing, and I also want to thank you so much for this one person that has made this video possible. In this video, I will be responding today to a question that I got asked in one of my comments. I'm having VSG soon. What birth control do you take? My docs keep recommending it. I also have PCOS. It sucks. Metformin sucks too. Thanks. Now guys, I want to apologize for this about 1 month already that I've had without actually coming up here and posting a video. I'm so sorry guys. I actually got a temporary tooth at the moment right now. I'm in the process of getting a crown done. I had a crown previously and my crown broke. So therefore I am getting it redone, and the reason why I wasn't here is because through these appointments, the very first appointment that I had at my dentist, I had my gums cut out, because what happened was that my gums through the years with the other crown that I had was overgrowing on top of the tooth. So I had that surgically removed through a blade. You can only imagine how painful that was. I actually had my gums swollen. They were inflamed. So it was actually really hard to talk. That's why I haven't uploaded a video. I wanted to let you guys know. As I move forward, I want to make clear what the term PCOS stands for. And the term PCOS stands for polycystic ovarian syndrome. So that is what PCOS is, guys. Moving forward, I want you guys to know exactly what am I talking about here and what is the viewer, and who I hope that is now a subscriber of mine, had asked. And I decided today, as you guys can see, I'm not home. I decided to come out here with this wonderful and beautiful New York City view. I actually live by here 2 blocks away, so I said why not. The weather's so beautiful. It started getting cloudy, as you guys might see, but nothing too bad. So I said why not, right? So the question is in regards to birth controls and what birth control that I take and metformin. So I want to address metformin too for you, because I actually was taking that birth control. Now metformin is usually prescribed for people with diabetes. So if you have diabetes, then you're most likely to be taking metformin. That's primarily what it is for. However, in the recent years, they have been prescribing that to women who suffer from polycystic ovarian syndrome, and it does help. I'm not gonna say it doesn't. Unfortunately, metformin brings horrible side effects that are not really worth to take. You know, the pros usually outweighs the cons, if there are cons in certain things, but in this case specifically, it's not worth it. I personally was struggling with stomach acid during the process that I was taking metformin. Stomach acid. I was also there's some nausea. You know, there are different side effects of this medication, and it's really bad. It is not just a little bit, because there are some medicines that you can just take and you know it's mild, the side effects. This one's persistent every single day, and I can say that these side effects start after a month or 2 of taking metformin. So yes, metformin definitely sucks. So right on, I agree with you on that. I no longer take it. Now let me explain why. After I got the gastric sleeve surgery, the sleeve, I was not able, and I have still not been able to take any pills that are bigger than a baby aspirin or Benadryl. Those are the only type of medicines or anything around that size that I can take fully. Because anything else that is larger than that, I need to crush the pill to be able to take it. My sleeve, as you guys may know from my previous video, or if you don't, then go ahead and watch. I actually have a whole playlist on my YouTube channel of my experience with the bariatric surgery that I received. So actually, as you guys know, the sleeve is a sleeve, like that's what the name is for. And basically what happens is that your stomach turns into a tube, like. So that big fat chubby size of the stomach is no longer there, because that's where the hormone that produces a lot of anxiety to eat, which is called ghrelin, is no longer, well, that's no longer inside of me no more, but that's where it gets mainly produced in the body. Anyways, that's another video for another day. But yeah, I have a tube-like stomach now, and as you can imagine, the capacity for things is very restricted. So just as food, also pills and the size of them is very restrictive for me as well. So my stomach cannot handle big pills. It cannot crush them down. I actually start vomiting it. And the thing about vomiting with the gastric sleeve is that when you vomit with the gastric sleeve, it is not pleasant. I know that vomiting as a whole is not pleasant, but specifically with the gastric sleeve, what you first experience is a knot feeling right here on your chest, and it's horrible. It's like when you eat, and usually if you have a whole stomach and you try to eat and you have water, so what you do is that you drink the water so that you can swallow down the food. But in this case, you can't do that because you already have that feeling of like something stuck on your chest. So if you drink water, it makes it worse. That's another tip for you. Anyways, continuing with the metformin talk. So yeah, I stopped metformin because of that. It was a really large pill, and I decided to stop it. Did the doctor ask me to? No. But you know what? By the way, the doctor did not ask me to stop, but I said okay. The whole deal with metformin is because you're taking it because of your PCOS. Now, whether it's because of PCOS or diabetes, eventually you're gonna get off of it. I remember that when I got my gastric sleeve about 4 months ago, the first thing that my surgeon told me as soon as I got the gastric sleeve was let go of the metformin. Now, the reason why he asked me wasn't because he assumed that I was taking for PCOS. As I said, originally that is prescribed for people with diabetes. So what happened was that he assumed that I had sugar level problems, you know, with or diabetes. So that's why he told me like don't take it anymore. But actually that's not the reason why. The reason why is because of PCOS. He didn't know that. So regardless, like they're going to ask you to stop taking the medication. Now if it's PCOS, he actually told me, if it's because of PCOS, then keep taking it, you know, because my problem with PCOS was that it was going on for a very long time. Okay, my menstruation. So he said, well, we don't want you to get anemic now. So if that medication is going to stop you from that happening, then take it. But I just I couldn't take it because my stomach wasn't taking large pills. And for me to be able to take it, I would have to have literally crushed that pill every single time I would take it. And this is a daily pill. And I don't know, I was just like, I'm not about to do that. You know what I mean? I got this surgery. I'm gonna lose weight. As I lose weight, this PCOS problem is gonna be resolved, because the reason why I even have it, the reason why you have it, is because of weight loss problems. You know, the weight loss issue just creates an even reason for it not to go. So, you know, I stopped taking it. I mean, I'm doing fine so far. I've only had my, TMI, but this is what this video is about. I've only had really my period for like 2 to 3 times after gastric sleeve. I had gastric sleeve 4 months ago on January 29, 2018. And it is currently, I believe, May, the end of May, the last week of May we're in. So almost 4 months, if not already. So yeah, metformin is not worth it. I do not take any birth controls. I am allergic to one birth control. The name is Aviane, don't know. It's spelled Aviane. And I was taking that medication, that birth control, prior, and I had to stop taking it. I actually ended up in the hospital because it was swelling up my liver. So I'm allergic to that medication. Birth controls as a whole is not something that you should be taking. I mean, doctors are going to recommend it because that's all that they know how to recommend when you have menstruation problems. But to be honest with you, it does no good. It never, I've taken many birth control pills for this problem, and they never really ever helped anything. They never stopped anything. They never cured anything. If anything, they made more problems come along the way. So my advice to you, to this person that asked this question. Oh, also guys, I will be posting before and after pictures. I already have posted some on my Instagram. So please do not forget to follow me on Instagram. My Instagram is your girlfriend Gigi. So don't forget to check that out as soon as you stop watching this video. In my my Instagram, I will be posting before and after pictures of my weight loss. I will be also sharing some tips, medications that I take, foods, you know, all of that good stuff. So anyways, going back to this question. So my advice to you is, don't worry right now about this. Don't worry about the pills, because to be honest with you, looking at it long term, you're gonna get off medications. You will. The problem, the original problem is because of the weight. The gastric sleeve is the solution for you right now, just as it has been for me. So with that being said, don't worry about like medication, stuff like that. What I'll tell you right now is just worry about this gastric sleeve. Worry about the surgery, because you don't know how your body is going to respond. Everybody has a different experience with the gastric sleeve. As you've heard from me, I cannot swallow big pills. My mother, she got the gastric sleeve. She's able to. She can. She had no problem. Props to her. And maybe you'll be like her, maybe like me. You never know. As the weight drops, your health conditions will be better. Eliminated if possible, which is the goal, right? I'm here to answer any questions that you guys may have. So worry about the gastric sleeve right now. Don't worry about pills. You're gonna get off of them one way or the other. You will, okay? So stand strong. I'm 4 months post-op. I've lost 57 pounds. Woo! I've lost 57 pounds. Probably even more. I haven't weighed myself in about a week, so I probably have lost 60 already. And it's been amazing, this journey. I'm so glad. You know, I haven't started actually lifting or doing like muscle workouts, which I will. But yeah, you guys, that's it. I hope I answered your question. Like I said, subscribe to my channel, ask questions, keep those questions going, guys. Have a wonderful and blessed day. See you next time.
When you were mine, shadows of the style still remain in my mind. I had to tell myself too late to try. Takes my breath away when I realize